Displaced 40-year-old Hadiza Ibrahim has been sheltering at a camp in Dikwa of Borno State for years. Hadiza and thousands of others like her had been receiving daily meals here, but things changed this year after US aid cuts reduced funding for humanitarian operations in the region.
If I eat today, I may be unable to eat tomorrow. We live in challenging conditions, and my husband cannot find work. Our village is not accessible to us to return to, which adds to our struggles.
The critical funding shortfalls have seen the UN World Food Programme close 150 centers in the northeast, while other aid agencies have stopped operations altogether. Aid workers at the Dikwa distribution site say many long-term beneficiaries were unexpectedly removed from the list this month, leaving them without support.
A lot of beneficiaries that used to collect their food for over 10 to 11 years, they came for this month and they observed that they were scaled down. Some of them, there is food in their cart, but it didn't download it. So they were asked them to go.
At least 31 million people in Nigeria are now facing acute hunger, according to WFP, including an estimated 15 million acutely malnourished children. In Borno, Adamawa, and Yobe states, a total of 7.8 million people are considered to be in need of humanitarian assistance. The UN Humanitarian Agency launched an appeal in January to address the escalating humanitarian crisis.
So one of the things that we are doing is that we are prioritizing scarce resources, so we're putting them to the best possible use. So we started off this year asking for $910 million to support 4.6 million people. We whittled that down to life-saving activities, so things that were aimed for the long term was then jettisoned.
However, the agency says only about half of the revised amount had been raised by August, which leaves families like Hadiza's facing growing uncertainty. Sophia Shimechero, CGTN.